Good day everyone, I am Christy H. the Love Dog from Group 6 and we're going to tackle about the emotional or conduct disorder. So, emotional disorder. What is emotional disorder? The term emotional disorders usually refers to mental health conditions like mood disorders. So, if ang tao gani use the term emotional disorders, they are usually talking about the mental health conditions that makaapekto sa atong mood or disturb a person's emotional state or mood. So emotional disorders can affect a person's ability to function in daily life and may manifest as intense as prolonged periods of sadness, as in like depression or extreme fluctuations in mood such as bipolar disorders. So, according to the American Psychological Association's Dictionary of Psychology, emotional disorders include psychological disorders where people have maladjusted emotional reactions that are inappropriate or disproportionate to their cause.
The risk of emotional disorders can be influenced by a combination of factors, including brain functions. The structure and chemistry of your brain may play a role in whether you develop a mood disorder. It imbalances in neurotransmitter can contribute to conditions like depression and anxiety. Genetics. You're more likely to develop an emotional disorder if a close blood relative has the same disorder. Family history can play a role in emotional disorders. If there's a genetic predisposition, the risk may be higher. Hormones. Recent research trusted source notes that increased levels of thyroid stimulating hormone are associated with depression. Hormonal changes such as during puberty, pregnancy, or menopause can affect the mood and increase the risk of emotional disorders. Substance use. Substance use, including alcohol and drugs, can increase the risk of emotional disorders and exacerbate existing mental health conditions. The use and misuse of certain substances can cause symptoms similar to mood disorders. And lastly, traumatic experience. Trauma, although usually associated with PTSD, can cause also trigger the mood disorders. It's important to note that these factors can interact vary from person to person, making the development of emotional disorders a complex interplay of multiple influences.
So let's proceed to its signs and symptoms. So please take note that the signs and symptoms of emotional disorder vary based on the individual and not everybody with an emotional disorder will have the same signs and symptoms. It's just depend gihapon na siya sa experiences. So the signs and symptoms of emotional disorders were generally divided into two groups. First is the depressive symptoms and the second is the mania symptoms. So let's have first the depressive symptoms. Depressive symptoms which occur in depressive disorders, bipolar disorder, and PMDD. So naani is ang kaning fatigue or lack of energy, ang feelings of sadness or hopelessness, feelings of numbness, loss of appetite or overeating, loss of interest in activities you usually enjoy, sleeping too much or not enough, thoughts of suicide, death, or self harm, and trouble focusing or concentrating. So the second group is the mania symptoms. So mania symptoms occur during manic or hypomanic episodes in bipolar disorder. So naani is ang engaging in risk-taking behavior like overspending money, driving recklessly or substance misuse, difficulty sleeping, feeling excessively or unusually energized, elated or confident, racing thoughts, restlessness or irritability, speaking of talking quickly. So, if you or someone you know is experiencing the symptoms, it's essential no to seek help from your family, friends, cousins, or special someone or sa mga mental health professional no kay para matabangan mo because it's very important na tagaan nato ni siya og pagtagay.
How do teachers, parents, and older individuals handle those kids with emotional disorder? 1. Keep class rules, activities simple and clear. Try to keep your classroom guidelines broad and simple. Let the students know about them on the first day of class and post them on the classroom. Number two, reward positive behavior. When they receive positive feedback and rewards, they start to see that there is a positive benefit to good behavior. They will then start to see you as more than an ally. And this will in turn motivate them to want to behave and to do well. Three, allow for mini breaks. A lot of EBD kids lack of emotional balance and maturity needed to remain focused on tasks for long periods. Instead of premeditating these students for their lapses, build in short rest periods for many breaks in the school day. Four, fair treatment to all. To ensure that you are treating all your students in a consistently fair manner, don't bend your establishment rules for any student. Enforce the expected consequences every time with every student. Five, and lastly, use motivational strategies. To avoid disruptive or off-task behavior, take some extra steps to motivate these students. Offer them incentive for academic success, large and small. Celebrate their hard work and praise their good effort consistently. This can go a long way in giving these students the motivation to excel in your class.
So now we are done with emotional disorder and let's proceed to conduct disorder. What is conduct disorder? Conduct disorder refers to a group of behavioral and emotional problems characterized by a disregard for others. Children with conduct disorder have a difficult time following rules and behaving in a socially acceptable way. Their behavior can be hostile and sometimes physically violent. So it is not uncommon for children and teens like us to have a behavior related problems at some time during our development. However, if behavior is long lasting na, it can be considered into conduct disorder, and also when makaviolate na ka sa rights sa uban, and if dili na siya acceptable ang imong norms of behavior, that's the reason na nga mahitabo na siyang conduct disorder or mahimot na siya nga kanang usa ka problem.
What causes conduct disorder? So there are two reasons why a person has a conduct disorder. First is because of the genetics, and second is because of the environment. So the genetic causes. Damage to the frontal lobe has been linked to conduct disorder. The frontal lobe is the part of your brain that regulates essential cognitive skills such as problem solving, memory, and emotional expression. It's the foremost part of the brain and is part of the frontal cortex. Here, frontal cortex. It's the home of your personality. Individuals with conduct disorder have close family members with mental illness, including mood disorders, ADHD, alcohol use disorder, depression, schizophrenia, anxiety, and personality disorders, which suggests that a vulnerability to conduct disorder may be at least partially inherited. Now let's move forward to the environmental factors. Environmental factors are the components that came from the individual's surrounding, such as the living condition of the family, the daily circumstances in the neighborhood or community, and etc. These factors also includes child abuse. The child experienced verbal, emotional, or physical violence from his or her family members. Next is the dysfunctional family. Relationships between family members are tense and can be filled with neglect, yelling, and screaming. The child might feel forced to happily accept negative treatment. There's no open space to express their thoughts and feelings freely. Next is parents who abuse drugs or alcohol. Parents are not capable or cannot take care of their children because of their addiction that hinder them in taking care of their family. Next is poverty. Due to the difficult circumstances brought by the poverty to the family, the parents are busy trying to make ends meet. They were not able to cater the needs of their children, especially time, love, care, and guidance. Signs and symptoms. Conduct disorder extends beyond normal teenage rebellion. In order to qualify for a diagnosis of conduct disorder, children must exhibit at least 3 of the symptoms in the past year and at least 1 in the past 6 months. Aggression towards people and animals. Number 1, bullying, threatening, or intimidating others. Like moingon og tambo ka pud nimo oy, banta jud ka sumpagon ta kaunya, or mang blackmail. Number 2 is initiating physical fights like manghagit barud og sunbagay or any other form of physical fights. Number 3, using a weapon that could cause serious harm like the usage of hard or sharp tools like ice pick, screwdriver, knife, and etc. 4. Physical cruelty to people, like physical bullying, manumbag, mambunog, and other physical violence. Number 5. Physical cruelty to animals, like labayon og bato ang cat or ang dog bisag wala mang hinabot niya, or even worse, killing the innocent animals. 6. Stealing while confronting a victim, like mugging, purse snatching, extortion, and armed robbery. Number 7. Forced sexual activity, like sexual harassment and rape. Other signs and symptoms. Property destruction. Number 1, deliberate fire setting or arson. Number 2, other destruction of property like throwing stones to the windows or any destructive material to the property. Another is deceptiveness or theft. Number 1, breaking or entering a house, car, or building like mangakit bahay, car hijacking, and trespassing. Number 2, lying for personal gain like stealing without confronting the victim such as shoplifting and stealth robbery. Another one is serious rule violation like staying out at night before the age of 13 and running away from home overnight at least twice. Another one is truancy beginning before the age of 13 or frequently missing or absent in the class without valid reason or excuse. Symptoms of conduct disorder can be mild, moderate, or severe. Mild conduct disorder is characterized by a pattern of defiant, disruptive, and disobedient behavior. Individuals with mild conduct disorder may display occasional acts of rule breaking such as lying, stealing, and minor aggression. Moderate conduct disorder represents a more serious form of the condition. Individuals with moderate conduct disorder exhibit a consistent pattern of aggressive, antisocial behaviors. They may engage in frequent fights, vandalism, truancy, and more serious rule violations. Severe conduct disorder is the most intense and concerning form. Individuals with severe conduct disorder demonstrate a relentless pattern of aggressive and harmful behaviors. This can include serious violence, arson, sexual aggression, and a complete disregard for the rights of others.
Hey everyone, now let's talk about handling children with conduct disorder. It can be challenging, but it is important for us teachers, parents, and older individuals to provide consistent and structured support. Okay, so now I will give you here some general tips. First is set clear boundaries. Establish and communicate clear rules and consequences for behavior. Consistency is key. Second is positive reinforcement. Okay, so you need to praise and reward good behavior to motivate them to make better choices. Third is seek professional help. Consult with a mental health professional or counselor who can provide guidance and specific strategies. Fourth is individualized approach. Recognize that every child is unique and what works for one may not work for another. Tailor your approach to child's needs. Fifth is role modeling. You need to set a positive example through your own behavior and how you handle stress and conflicts. Sixth is communication. You need to encourage open and respectful communication. Listen to the child's concerns and feelings. Seventh is teach problem solving. You need to help the child develop skills to manage their emotions and solve problems more constructively. Eight is consistency. Maintain consistency in expectations and consequences both at home and in school. 9 is social skills training. Work on building their social skills and empathy, helping them understand the impact of their actions on others. 10th is support network. You need to involve others trusted adults like counselor, family members, or friends to provide additional support. 11th is medication. In some cases, medication may be prescribed by a healthcare professional to manage specific symptoms. 12 is stay patient. Children with conduct disorder may test your patient, but it's crucial to remain calm and understanding. Third is 13 rather, make use of an ABC chart in which as soon as possible after a target behavior has occurred, you make a note of the things that preceded it and then what happened afterwards, including not just what you as a teacher did but also what others such as classmates were doing.
So that's all for our part. God bless and thank you everyone.